What a wonderful night last night at the Chef Expo, and what an incredible panel today, now, this morning, and our policy folks. So there are a lot of questions, and I've got 2 pages of my own questions. So we heard from Dan and Aaron, but we have 2 additional panelists, Stacy and Denisa. So I'm going to go ahead and ask Stacy Hammer to give us just a brief introduction of yourself, and then we'll have Denisa give a brief introduction of your background, and then we'll get into these questions. Stacy?
Thank you, Dr. Jernigan. Hello, everyone. I'm Petuashe. I'm Stacy Hammer, and I am currently the National Nutrition Consultant for Indian Health Service. I'm a new Fed. It's been about 6 weeks in this new role. Prior to my appointment here at IHS, I was a Director of Community Health and Registered Dietitian for the Lower Sioux Indian community. I am also an enrolled member of the Lower Sioux, so we're located about 1 hour and 45 minutes southwest of Shakopee here, so we're one of the 4 Dakota tribes here in Minnesota. Some of my background work for my tribe over the past 10 years has been building up public health infrastructure around nutrition programs, such as our Shanshayapi Food Pantry program, our Elder Nutrition program, and just some other programs here within the Lower Sioux Indian community. So, thank you.
Thank you. And I am probably your biggest fan, Denisa. I could listen to you all day, but some folks here, they know you, but they don't know some of your background, if you would.
Yeah, thank you, Dr. Jernigan, and to my co-panelists. Yatse, I am Denisa Livingston, and if you guys haven't met my twin, she's the MC. And I'm really excited that many of you are new to the conference, but may not be familiar with the work that we've been doing. For the past decade, I've been leading a grassroots organization called Diné Community Advocacy Alliance on the Navajo Nation, and working with the sister tribes there, with the Hopi, the Ute, the Apache, and also the Pueblos. We worked on an important measure, the Healthy Diné Nation Act of 2014. It took us a couple of years to pass the still only now the U.S.'s only unhealthy foods tax. And some people call it the junk food tax, but we say Iyambajol, and a sister law to eliminate tax on healthy food with an emphasis on indigenous foods. And so since then, we've been consulting on indigenous public health systems. I'm one of the University of New Mexico's Tribal Data Champion Fellows. So spending the next year upcoming on indigenous data sovereignty and really looking at what that means and research methodologies. And then I just recently graduated from OU Law in Indigenous Peoples Law, really focusing on international Indigenous Peoples Law. And so many different roles and hats. In the pandemic, I started an Indigenous public health firm, and so we've been consulting on federal policies, but really the emphasis is helping our community members to lead without a title. So from the youth all the way to the elders, to be involved in policy and policy innovation, and as well as being a change maker. So with Nick Tilson and Chef Sean Sherman, we're Ashoka Fellows. So really leading the change in the world from the local level to the international level. I was an international elected leader for 5 years, and so really coming down from that and thinking about how we can elevate the stories and narratives of Indigenous peoples in the right manner, in the appropriate manner, but also looking to address the unhealthy food. You know, food sovereignty is very beautiful, but who is addressing the unhealthy food, the chips, the candy, the soda? So that has been our work, and really looking towards innovation policies, and as well as looking at how we can work with allies and partners to be able to do this. Because if you guys know our experience, and you can ask Grandma Google about our work, she'll tell you about the work that we've been doing. But we've been really slammed by these big industries and companies to eliminate us and to eliminate our work. And so I'll talk a little bit more about that, but that's a brief in general. Thank you.
Thank you. Excellent. So there's so many questions, and there are very broad questions, and there are really, really specific questions. I'm going to start with one question that I'd like all of the panelists to offer an answer if you would like. There's a lot of excitement and enthusiasm about both the local foods program that you mentioned, Dan, just on one of your last slides, as well as that FDPR 638 program. And there might be some confusion around what the differences between those two are. So what I'd like to know is if you could explain just very, simply the distinction between the two programs, and then from the perspective of those of us who work more on the nutrition side or public health side, what data or evaluation information do you need that we might be able to help provide or support to get those programs expanded? Because in my view, that is the most exciting potential of food sovereignty for us right now.
Sure. So I can talk a little bit about that. The LFPA, as Dan mentioned, is a cooperative agreement program with USDA. 638 is from Public Law 93-638, the Indian Self-Determination Education Assistance Act of 1975. 638 specifically is a little more robust and a little more powerful in terms of actually recognizing tribal sovereignty. The intent of that authority from 1975 to today has been to recognize that tribes are sovereign nations with the inherent power to regulate for the health, safety, and welfare of their people on their lands, including, now that this is applied to USDA, the food that goes into that FDPR package in limited circumstances based on the demonstration project. So technically, 638 is more powerful in terms of recognizing tribal sovereignty and moving federal actors out of the driver's seat to make way and pass the microphone for tribes. That's a mixed metaphor, and I'm sorry about that. It offers more opportunities to tailor programs to the unique circumstances of a tribal community, especially if you get into compacting. That's a lot broader in terms of an authority and what you can actually do with those federal dollars to support your community, to tailor the program in a way that meets the unique needs and respects the relationships when you're talking about traditional foods, respecting the relationship that those foods have had with your people specifically for thousands of years. It's a little different in the cooperative agreement space. A cooperative agreement does what it says on the tin, it's cooperative. That means that you are a partner with USDA, and any kind of, by law, any kind of cooperative agreement that anybody enters into with a federal agency like USDA has to have what's called substantial involvement from the federal cooperator. That's a contingency of the money, that you don't get to be able to spend it without that substantial partnership. So it's going to come with a little bit more rules. That's not to say that LFPA hasn't been a fantastic program. I think Dan gave you some great examples of how that's worked. And I think, the answer to whether or not they should both continue is absolutely yes. I will say, I didn't get to mention it in my talk, in my speed run of the Farm Bill, but we have seen potential language. I don't believe it's public yet, so I don't want to say too much about it, for like an LFPA-like extension that could be included as part of the next Farm Bill. Obviously, that'll be subject to debate, just like all the other provisions, but that's a little bit about how those two things work.
If I could just provide a follow-up on it, and I think Aaron outlined that well. But looking at it from on the ground and implementation level, the challenges with the current iteration of 638 is you need to, for anything you're going to put in, you need to take something out. So let's say we want to do maple syrup, putting it in. Can't do that because there's no sugar. There's nothing you can take out. You can't take white refined sugar out and put maple syrup in because there's not white refined sugar in. For LFPA, there are some limitations of minimally processed with the plus, but it's more, hey, here's 2 million, 3 million, whatever the allocation is, go ahead and really build a program as you want. But that's where I say the grand social experiment. I think what we need, how are different tribes using it? The Wallace Center is doing some analysis on states, but we have some information that we've collected, as I showed, with Elder Food Box. I'm just so curious a year from now. What are different tribes doing? I'm talking to folks here, and okay, you got $2.5 million. How do you do that? You need to grow enough product to be able to put in. So it's kind of a different way of approaching versus here's $3 million to go build a greenhouse or something else. So it's a bit of a different approach, but I think that's where this group to just be aware of, this is pretty exciting.
Mm-hmm. And Stacy and Denisa, on the sort of health policy and nutrition end of this, what can we do to show the value to, I guess, policymakers, federal policymakers? Are we looking at people's self-reported health improves, people's dietary intake improves? Are these the kind of outcomes that we are wanting to show from those programs that would have value to advance them?
I guess for us, so two different layers here. So coming from the community level and working on that, 2016, we passed our first healthy foods policy in our community. I remember coming on the stage here, it was really exciting. Janie Hipp was super excited. I had the resolution in my hand. So at the community level, it's one of those things that as long as you have community input, we had our Health and Human Services Advisory Committee that came together that worked with, I know a friend of mine is out here, another attorney, Julie Ralston-Aoki from the Public Health Law Center, like bringing these folks together and having these conversations and what that looks like and putting that into policy, I think at the community level is really, really important. And every community is in a different place too. I mean, our community, we're 1,200 members. We have a small land base. So while we would love to have a bison herd and we would love to have more production within our tribal land, we just don't have the land base. So what are some ways that we can partner and make that happen, in our community? And so when we look at things at the community level and where community capacity is, for us it was okay during the pandemic, partnering with the state on our first ever food pantry program that came from federal dollars, from the CARES Act funding, and then eventually came the ARPA funding and those pieces. So again, I think like was mentioned earlier, I think tribes, we know what we need to do to feed our own people. It's just there's so many different barriers, and I really appreciate both Aaron and Dan's talk, especially the Farm Bill piece where you mentioned, this, and I think Dan, your last slide too, is state policy. I think that's one of the biggest barriers for, at least for our tribe, is that SNAP piece. It's going from the federal dollars to the state to the county, and unfortunately our neighboring county has not been helpful. Denies a lot of our community members those SNAP benefits. So, looking at policy from the federal side to the local community side, there's so many layers to it. And I think as far as looking at, providing data, now in my new role with Indian Health Service, I'm the program official for the Produce Prescription Pilot Program, which just started 2 months ago. So we're really excited that we're working with these 5 tribal grantees with this pilot program and working with them on what is that going to look like. And we've had our first one-on-one meetings with these grantees, and they're all in different places. They're all have a different capacity of what they could do with this program. And we're looking at evaluation methods. We're not handing them a packet to say this is how you have to evaluate your community. We want them to work with us and tell us what's the best way to evaluate this program. The hope is for this to be a sustainable program that federal dollars can eventually sustain, similar to what you see the SDPI program in 5 years. So yeah, I think data-wise, I think we have to continue to work with tribes and let the tribes tell us what is the best way to collect that data and make that resonate with the federal government.
Excellent. Denisa, anything?
Yeah, so I think many of you have been wondering about the unhealthy foods tax, the Healthy Diné Nation Act, and we're waiting for the revenues to be reported by the Navajo Nation Tax Commission of what revenue was generated during the pandemic, because many of our people were buying their breakfast, lunch, and dinner at the convenience stores. And so we want to know what those numbers are. As of 2020, we've raised over $9 million, funded over 1,000 community wellness projects from the unhealthy foods tax. And so when we look at the evaluation, when we're looking at how to do the evaluation, I mean, we're talking about generations of change, right? To change our eating habit, it's going to take many more years. And for funders out there, sometimes we can't meet, the demand of, reporting outcomes in a year or 2 or 3 years. It took us a decade. It took us this long to come this far to be able to address this. And so that is really a critical thing. The other thing that we're working towards, we recently had a gathering last month for the sugar sweetened beverage reduction strategy working group. So advocates from all across the nation have been addressing the sugar in different items. And more recently, some of you have maybe read about the sugar in yogurt. And so what about the healthy foods that have, more sugar than is needed, right? And then also addressing target marketing. So we work with Berkeley Media Studies to be able to think about target marketing, what that looks like. Because when we look at the taxation in Mexico and what has happened and the threats that have happened in Mexico from the Mexican tax on soda, we're looking at how their communities have been harmed and continue to be harmed, and also the contamination of the water that's happening. And when we went to Kenya and other parts of the world, we're also looking and also trying to follow the sugar cartels, because they are harming indigenous communities. Sugar is harming our communities on a worldwide level, and this is something that's really important. So as we build solidarity, it's so important as we think about the evaluation and the importance to be able to address this. It's a critical thing on an international level. And how do we implement that in federal policies and local policies? And for me, for the Navajo Nation, we don't have a comprehensive food policy. So we've been trying to work towards that. We've been trying to advocate towards that. During the pandemic, we renewed the Healthy Diné Nation Act because it had a sunset clause of 2020. And so we went back and removed the sunset clause, went through the whole legislative process to be able to do that. And still our people did not refuse, to pay the tax. They said, we're continuing this funding as we see it essential, because the funding goes back to all 110 Navajo chapters on Navajo to be able to implement different projects, whether they want to do instruction, improvements, grant making, grant funding, matching, and even projects, for the health emergency preparedness. We didn't know a pandemic was coming, but we wrote in the fund management plan that these funds will be available. So in the PPEs, the mask, when Navajo was at the epicenter of the pandemic, we had the funds available for chapters to be able to buy food, to buy water, and that was quickly available before the Relief Act, before the CARES Act, and then before Tribal Council actually approved a budget to be able to help the Navajo people, and my people were suffering. And we lost so many people just because of that lag and because of the process. But the unhealthy foods tax have been able to fund and support communities in that way. There are many other ideas, that we have to be able to do, like a stoplight legislation, to be able to go into the grocery stores on Navajo and maybe put like a red light, for unhealthy food, a yellow light, and then a green light to be able to know, like, this is, the healthier part of the grocery store. So when we did the unhealthy foods tax, we worked with Bashas', which is the first grocery company, to be able to say, we want to implement this. So myself and my late advocate, Deborah Cayedito, we went into the grocery store and literally scanned every item to be taxed, because we're taxing almost everything from, donuts to ice cream to, we have the whole definitions. We had to write the definitions of unhealthy food. At that time, there was no scientific definition of what junk food was. In our piece of legislation, there's not the two words of junk food, because there's junk and then there's food. So we had to put unhealthy food. So we don't say the junk food tax anymore. But we went into the grocery store, we scanned every item to be taxed, and then we scanned every item to be tax exempt, because my people were actually paying tax on healthy food when the surrounding communities were not paying tax. So we tried to raise awareness about that. And so it's been really, critical to be able to think about what that looks like. But we've influenced other policies around the world to be able to ban junk food or unhealthy food, and so, even that presence and also influence to be able to do that in other Indigenous communities is really important. But we need more support to be able to do that, because it's very hard work to be able to address these sugar cartels.
Thank you. And I really appreciate, Navajo Nation has really been a leader in this area. Mm-hmm. And I know so many of the other communities that I work with have really learned from what is happening there. I'm glad that you phrased it the sugar cartel, because I've never actually heard that, and it is so accurate. In the science of nutrition, which we have so many experts here in that area, we are really learning more and more about the ways that these foods affect our brains, including those ultra-processed foods, which actually override a person's feeling of being full. And so if you just think about that simple fact, that leads to overconsumption, and then you've got the subsequent health problems. but we know so little about what those foods actually are and what they do to the body. That's an emerging science. I'd like to ask one of the questions posed. When Native folks are displaced and living in diaspora, how would you recommend planting their crops in a non-colonized way and to be respectful and show appreciation?
You know, I've been in a position of, you want to grow, how do you do it? The land, the equipment. I showed that aerial there of, I've got equipment, it's called a BCS, walk behind tractor, and I've got an attachment on there. I can plant straight into reed canary grass, really invasive grass, or quack grass. Just plow a narrow little strip, plant right in there, mow in between. That's one mechanism. I think though that you just kind of got to look and see within wherever you are, is there community garden? Are there, where can you get to be able to get to some land? Or if you can't do that, raised beds. I mean, myself, I started growing in buckets on the balcony. I mean, and so but this is a challenge, but I think some of it, networking, connecting, finding others, and looking at where can you get resources and some of that shared equipment, and of course seeds as well.
Excellent. I wanted to go to one of the next questions that was posed. Are SNAP Ed and EFNEP part of the Farm Bill? And if so, are there any updates you can provide on these programs in relation to the 2023 Farm Bill?
Yeah, I can jump in there. Yes, absolutely. And SNAP Ed particularly, let's talk about SNAP Ed. Thank you for asking, because I didn't get to it in my presentation. SNAP Ed is one of the pieces that tribes are not able to access directly when it comes to nutrition programming at the federal level. Tribes have to go through states to be able to access SNAP Ed funds, which essentially subjugates tribal sovereignty to states and is completely inappropriate. So that definitely needs to be addressed, and it would have to be addressed in a farm bill. That's a longstanding priority of the Native Farm Bill Coalition, going back to 2018's Farm Bill and again here in 2023. The marker bills that I mentioned from Tina Smith and Senator Tina Smith and Senator Rounds that would apply 638 to SNAP would be a first start at doing that. If you look at the actual legislation, you have to make a couple of different changes. There's one thing that opens up SNAP to either tribal administration or 638 opportunities, and then you also have to go into the rest of the bill and fix the SNAP Ed access. So those are two different things, but we've got some good legislative support with those marker bills out there, so that would be one way to address that historical inequity and make sure that tribal citizens are actually receiving culturally appropriate nutrition education from Indigenous nutrition educators using federal funds. Yeah.
Thank you. Data sharing is a barrier for community-led health programs to work with IHS dietitians, even on the pilot IHS food prescription grant. Why? Any pointers?
Yeah, data sharing is really, as a whole, I think is really a barrier. I think with each tribe too. I mean, because again, what does the tribe have in place for any type of data sharing agreements, whether it's with the state, whether it's at the federal level. As far as the pilot IHS food prescription grant, I'm not sure where the barrier is there. Like I said, we just started that program here in the last month working with those grantees right now. So, I'm not quite sure that I can really necessarily speak to what barrier there is at this point. And again, it's a matter of the type of data that, within that grant, within that pilot program, the data that is in the NOA Notice of Award is basically, the type of things that they're utilizing from their EHR system when they have patients come into the clinic setting and check for the A1Cs. Each of those grantees has a different target population that they've identified. Some have identified, they do the food insecurity tool from the USDA, and if they find them food insecure, then the target group can be those that maybe have diabetes or prediabetes, or some have chosen obesity as a target group. So there's different target groups within each of those, with each of those sites that they have themselves identified. And so the data that we will eventually collect for that piece is going to, again, help within this next 5 years to see what those outcomes look like on that side of that pilot program.
Yeah, and I think I can, excuse me, add a little bit to that. We've had a big experience with that, and when we were writing the pieces of legislation and the laws and policies, we had a very difficult time getting the findings, putting the findings in writing because we did not have access to the data. And eventually, IHS was asked to be removed from doing the collaborative work with our work, and to this day, we're still trying to restore that relationship because they could not be a part of taxation, an effort towards taxation. And yet, you know, it was something that we were trying to address, diabetes, right? Diabetes and obesity was what we were addressing a decade ago, and yet our own Diné people that work for IHS were very passionate about being involved, and it went to tribal council, and the lobbyists from these companies, the red and white company with the polar bears, they went into tribal council and said, you know, we got to remove the Diné people from being involved with this work. And it really harmed the work being done because research is ceremony. And they're researching us. And we can't get that data from them. And it's really put a burden on our work, but the resiliency about what happened, communities started to get on board and to do community health assessments on their own. We started, if you see the drafts, the different variations of the drafts of the Healthy Diné Nation Act, you see the increase of findings. And communities said, we're going to do the work. We're going to, you know, go out into our communities and be able to get the research and get the data to be able to present to tribal council about the need to be doing an unhealthy foods tax. And this is something on an international level. Why are we not incorporating the UN DRIP, the United Nations Declaration of the Rights of Indigenous People, into our constitutions? If you have a tribal constitution, or if you're working towards that, how do we put that into the laws? Because when it comes to Indigenous data sovereignty, it's really important to know that research is ceremony. And how do we work towards that sacredness and restoring that relationship, and also not be in the positions that we have found ourselves? And so it's important as we think about addressing the sugar cartels that we stand in our inherent pre-constitutional sovereignty. And we practice that. We practice polycentricity and also autonomy. And how do we do that regarding sugar? How do we do that regarding our people getting amputations from their diabetes complications? Because I've been there and seen it, and seen their toes get cut, and their leg, and then eventually that leads to death. When are we going to stop that from happening? And how can we together?
Thank you so much. And I want to just wrap up by saying deep gratitude to all of our amazing panelists. And I would be remiss if I did not ask the number one question, which was toward Dan, which is, when is the next Food Sovereignty Summit going to be held, and where? Because there are inquiring minds out here, and they want to know.
Well, for the intertribal food summits where we're outside, hands-on, we're still doing things just more community scale. And so I think that the big answer to this is, if you want to see it, host it in your community. We can talk. And if someone wants to do a big one, well, let's talk more. And I don't know, that's maybe sometime next year. But it's, for me, for those big ones, that's 3 months of my time full time. So they're big events, but we need you to help host them. And do it in your communities.
And also 2 weeks ago, we had the International Corn Conference on Navajo in Shiprock. We had the UN Special Rapporteur, Mr. Francisco Cali, come, Andrea Carmen from the International Treaty Council. We had some amazing folks, the chocolatiers, the Mayans from Belize. And we just had this beautiful gathering. And we're trying to plan something in the spring to be able to host something, talking about healing and leadership, community engagement, and also of Indigenous foodways. So, if we want to join together, and I met some relatives right here from near Zuni, we need to unite and bring these together. And the other thing I want to suggest is that for years now, I've been asking, let's have a sugar summit for Indian country. This is something we need to do. So connect with us.
And the last thing on this, tribal policy. Getting those chefs in this kitchen, I know the little bit I heard, I mean, that wouldn't have happened 5 years ago, might not have happened, even right before the pandemic. But pushing to do that, if you're hosting an event, if you're in your tribal casino or wherever it is, these are tribal facilities. Part of the policy is it shouldn't be that hard to be able to get our foods in, to be able to get our chefs, and when I say chefs too, that's our community members, our elders being able to get into the kitchen too. So that's part of that policy, and beautiful event here. Thank you so much.
And another announcement. Okay, and also please support Indian Collective. They are building the pavilion in Dubai for the upcoming COP28. That's coming up in a month. And so if you want to be a part of that, please get your passport ready. Please have your ribbon skirts ready and your beautiful jewelry for that. And then also incorporate UNESCO's Decade of Indigenous Languages from 2022 to 2023. And also connect with us on the stock takes of the UN Food System Summit, because I was one of the appointed champions, where now Indigenous peoples are one of the 5 stakeholders for the summit. So hopefully you guys will be involved in any of that international work. Thank you.
Thank you, everyone. Thank you so much, panelists.